Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Up next in the Hydration with Heart segment, brought to you by Once Upon a Coconut. In the Expert on the Microphone series, we have two incredibly inspiring guests who are here to shed light on a condition many of us may have never heard of, but is considered one of the most painful medical conditions, trigeminal neuralgia, otherwise referred to as the suicide disease. First, joining us is the incredible Dr. Mark Linskey. He's a renowned neurosurgeon and advocate for facial pain disorders. He has dedicated his career to helping those suffering from conditions like TN and has performed life-changing surgeries to alleviate the suffering of his patients. We're honored to have his expertise today as we explore this condition and the complexities surrounding it. We're also joined by Kathleen Klein. She's an advocate for trigeminal neuralgia and founder of FaceForward, an organization dedicated to raising awareness for TN and other facial pain disorders. Kathleen's story is nothing short of inspiring. She's lived with this excruciating condition for over 11 years and has turned her personal battle into a mission to advocate for others who face the same silent, deadly struggle. Today, we'll be hearing about her expertise and her experience and the work that she's doing to bring awareness to this silent crisis. Now, for those unfamiliar with trigeminal neuralgia, or TN, let me give you some basic background. It's a rare chronic pain condition that affects the trigeminal nerve, one of the largest cranial nerves, which provides sensation to the face. In this condition is marked by sudden, severe facial pain that's often compared to electric shocks or the feeling of a hot iron pressed against the skin. And according to researchers, it's estimated that around 150,000 people are diagnosed with TN each year in the US, but many go undiagnosed for years. And what makes this disease so brutal is that it can strike at any time, turning the simplest actions like chewing, talking, or even smiling into unbearable agony. And like I said, it's often referred to as the suicide disease because of the mental and physical toll it takes on sufferers. With that understanding, let's dive deeper into what living with TN is like and what the medical community is doing to help. Welcoming now to the show is the incredible Dr. Mark Linskey and TN advocate Kathleen Klein. Welcome, superstars.
Thank you so much for having me.
Great to be here.
Thank you so much. Dr. Linskey, it's hard to fathom the kind of pain described by TN sufferers like Kathleen. The fact that a misfire of the trigeminal nerve can cause such agony is staggering. So can you explain to our listeners what exactly causes trigeminal neuralgia? Why is it that this nerve pain in particular can cause such intense pain?
Well, absolutely. In less than 5% of cases, trigeminal neuralgia can be caused by something pathologic that you would see on a magnetic resonance image, such as multiple sclerosis or a tumor or a cyst or an abnormal blood vessel or collection of blood vessels. But in 95% of the time, it is caused by one or more normal blood vessels coming in contact with the nerve root in the crawl space between the brainstem and the skull and causing compression, erosion of the insulation of the nerve, and triggering of the pain fibers. The reason it's so severe and so difficult in the face is that the trigeminal nerve, which provides sensation to the face on each side, is the largest sensory nerve in the human body, and it's exquisitely sensitive to facial pain disorders.
Wow, that sounds very complex, especially to diagnose and more importantly to address. Kathleen, you've described trigeminal neuralgia as being akin to lightning strikes to the face, and I can't imagine how living with this daily impacts your life. What's more remarkable is that despite this, you have managed to become a powerful advocate for others. You've built FaceForward to help raise awareness and support, turning your personal pain into a public mission. What inspired you to start FaceForward, and how has the support that you've received from the community shaped your vision?
To be honest, when I was first diagnosed with trigeminal neuralgia, I faced some very dark and scary times. I was newly remarried. I was a mom of 4 young children. I was 18 years into a career that I absolutely loved. And now I was struck with this new condition, and it was life-changing. And I really lost myself in that. And I just kept wanting to go back. And I spent a lot of years alone in that. Then I realized through my faith, mostly, that I needed to stop looking back and face forward. I needed to find purpose. And I still had that passion of helping others burning inside of me. So I learned to pivot, and that's how Face Forward was born. Because living in today's world, whether you're dealing with chronic pain, mental health issues, loss, there's a myriad of challenges we face every day. There are so many people that suffer alone in silence.
You're right. Now, Dr. Linskey, in your experience, how do TN patients often cope with exactly what Kathleen was just referring to, the psychological burden of this disease? And what role does the medical community play in supporting them beyond just treating the physical symptoms?
Well, it's a great question. This syndrome has a devastating effect on patients' psychological and emotional well-being, as well as that of their spouses and their family. It's not just the patient, it's their whole support and family unit. Unfortunately, it's a progressive syndrome. While medication can temporarily mitigate the problem in terms of pain and suffering, almost all patients eventually need surgery to deal with the syndrome.
Wow. It's the more I hear of it, the more I have so much respect for you, Kathleen, for dealing with this. Now, Kathleen, you've spoken about the immense financial and emotional burdens that TN sufferers face, and it's something that many chronic patients endure. You've been through two brain surgeries yourself and countless procedures and an overwhelming number of treatments. So, given the challenges you have faced in seeking relief, can you talk about your experiences with surgery and treatment and how you've balanced the mental and emotional hurdles with this condition?
Yes. So, luckily, I was diagnosed quickly, and I say that because it does take sometimes people years to get diagnosed. And I had gone through many medications, different treatments. I had my first brain surgery. It did not work. It brought on more pain, more chronic migraines. I did a lot of research. I found Dr. Linskey. I quickly realized that he was my doctor, and I would not want to put my brain in anyone else's hands. So I had gotten a second brain surgery with him, but my case was a little more complicated. I had other neurologists as well. So he did a redo, and it was very extensive. It was a very complicated case. So he did help take away that electrocution type pain, but I still have the constant pain, where you feel that you have, I liken it to like an iron on your face, you feel. So my pain level is around a 5 every day, and it will just vary depending on the weather, if I'm talking too much, if I'm not sleeping, the food I'm eating. Um, so it can
It
really,
sounds like it's hard to really manage, and I wanna ask Dr. Linskey this. TN, to my research, doesn't just come with its intense pain. It's also one of the most difficult conditions to treat, and especially after hearing both of you speak right now. So current treatments, including surgeries like microvascular decompression, are not always permanent solutions, and many patients, like Kathleen, still suffer, to her point, despite these multiple interventions. And historically, there have been many limitations in current treatments for TN, but there are emerging therapies that offer hope. So, what advancements in your medical research or emerging treatments offer the most promise for patients with TN, and how do they differ from the traditional surgical approaches?
Well, initial therapy for this condition is usually medical in terms of therapy, medications, anticonvulsant medications, anti-seizure medications, and there are new ones coming along all the time. The problem is that they only temporize, and this is a progressive syndrome. The most effective treatment by and large, I mean, without question, is addressing the cause of the syndrome, the vascular compression on the nerve, and that's the microvascular decompression, the MVD that you just described. And it is potentially curative, not just a long-term solution, but potentially a forever solution. In proper surgical hands, the recurrence rate is only 10% at 10 to 20 years. But there are other procedures that can be done, but they're generally palliative. That means that they address the symptom, not the cause of the problem. And as a result, they tend to have a high recurrence rate and a progressive syndrome. And all of these procedures share one thing in common: selectively partially damaging the nerve on purpose, with the goal of treating a relief of pain for a chance of causing numbness and nerve damage. And that numbness and nerve damage can lead to what Kathleen's describing, atypical neuralgic pain, which is constant, as opposed to the intermittent sharp stabbing shocks, which are the characteristic syndrome of trigeminal neuralgia. There are also other procedures that implant electrodes to try and stimulate the peripheral branches or the motor cortex or the deep brain to try and fool the brain into thinking you're not in pain. But those also are not permanent solutions. By far and away, the best solution is a well-done MVD done by a surgeon very experienced and skilled in it as the first intervention. That gives your best chance of not having atypical neuralgic pain and having a permanent solution going forward.
Sounds like if you do it wrong from the onset, you've opened up Pandora's box, and then it's hard to reseal that. So
Exactly.
the first intervention is key, and unfortunately, to my understanding, he was your second beacon of hope, right?
Yes. Yes.
Well, you're in good hands now. Now, you have become a beacon of hope for many people facing similar conditions despite your ongoing struggle. And we know that this past October 7th was International Trigeminal Neuralgia Awareness Day, and your efforts to bring awareness have been tremendous, Kathleen. I commend you. What do you hope to accomplish on a larger scale as an advocate for TN sufferers?
I guess I want the world to know more about trigeminal neuralgia because it is so very rare. And a- as with any other invisible illness, you look like you are okay. And people often say, "Well, you look good." But they don't realize the pain, the excruciating pain that you can feel. And unless you do feel it or you witness someone who has felt it, you don't believe that a pain can truly exist and not kill you. So most days are filled with uncertainty because you don't know what's going to happen from day to day, from hour to hour. And the pain is unpredictable. So you may be able to do something, at one time, and but you'll suffer for days after. Or if you're able to do that one thing, you may not be able to do it again. So I really want to encourage people to be patient and compassionate, show kindness to us because we really are trying our best with something that is very rare and is very scary to us.
Yeah. Sounds like you're dealing with a roller coaster of emotions, symptoms, and even consequences. Um, Kathleen, you're doing a great job at managing it all. Dr. Linskey, given the fact that TN can be misdiagnosed for years, and as you mentioned earlier, finding the right treatment early on is critical, what are some of the early signs of TN that patients and primary care physicians, more importantly, might overlook? And how can we improve the diagnostic process to reduce the number of misdiagnosed or undiagnosed cases?
The trigeminal nerve has three divisions: Division 1, Division 2, and Division 3. Trigeminal neuralgia affects Division 2 and 3 first, rarely Division 1. And your teeth, upper jaw and lower jaw, are innervated by Division 2 and 3. And in fact, the vast majority of trigeminal neuralgia patients, when they have the problem, think they have a problem with their teeth, and they go to dentists first. In fact, 50% of trigeminal neuralgia patients have unnecessary dental procedures, including root canals and dental extractions, trying to get rid of the pain because the primary care doctor thinks it's a dental issue, the dentist thinks it's a dental issue, but it's not. That's the biggest mistaken issue out there in terms of getting people to correct diagnosis. It's such an orphan disease affecting only 6.5 patients per 100,000 per year that most primary care physicians, most dentists, even most neurologists have never seen a case. And so getting it diagnosed properly and getting it treated properly with the right anticonvulsant medication, at least initially, takes a long time. And the patients are horribly suffering until that diagnosis is finally made. And then the delay to get to a neurosurgeon The average board certified neurosurgeon sees only 1 to 2 of these patients every 3 years.
Wow.
That is not going to lead to expertise. It's not going to lead to correct diagnosis. It's not even going to lead to significant experience with the surgeries for this condition. That means that even the neurosurgeons who have a lot of experience with this are very few in number. We're maybe 6 to 12 in the whole US. And trying to get to those neurosurgeons in modern healthcare situations where your panel of providers is strictly limited is extremely hard.
Wow. This is the work you do, doctor, is very, very calculated. And I love that you've come on to shed light on this particular topic. I had no idea how complicated this was, how painful this was, uh, the extent of the damage physically and emotionally and mentally. And Kathleen, I mean, your personal experience in advocacy work have shown just how isolating and devastating TN can be. However, through FaceForward, you've helped build a community of support, and that should be so rewarding for you. So, what advice would you give to others who are going through this? Not how the community should be treating them, but the ones who are actually going through this and feel like they're alone in their pain. How can FaceForward help them find support and hope?
So to go off of what Dr. Linskey had said, you really need to do your research and be your own advocate. And that is why I went all the way to California from New York to see him, because he is an expert. But just as someone who's suffering, you need to learn to give yourself grace, and because the fear and failure and despair and guilt can really take grip of you. And it took me a long time to realize this, that we don't need to sit in silence alone with this. And for me, FaceForward is more of a movement. It's trying to promote a message of hope and resilience and positivity. It's a platform where, whether you're dealing with chronic pain or mental health issues, you can wear your story and not suffer alone in silence. And I think the biggest thing is embracing your journey, trying to spread positivity, because the world desperately needs that. And it's more of a platform where we can connect with others. And we might be facing different challenges, but the bottom line is we're better together. And if we're together, we can get through anything, no matter what we're facing. So
I love that. And with that, we are officially out of time. I want to thank you both as we wrap up today's segment. Thank you both, Dr. Linskey and Kathleen, for sharing your time, your expertise, and your powerful story with us today.
Thank you so much for having us.
Thank you very much.
That was the good doctor, Dr. Mark Linskey, and that was the incredible Kathleen Klein, Trigeminal Neuralgia advocate and founder of FaceForward, an organization dedicated to raising awareness for TN and other facial pain disorders. You could head to alwaysfaceforward.com and check her out on the gram at alwaysfacefwd. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by Once Upon a Coconut.
Discover the refreshing taste of 100% pure coconut water that actually tastes great. Naturally sweet with no artificial flavors or added sugar. It's packed with electrolytes to keep you hydrated throughout your day. And with 10% of profits going to charity, every sip makes a difference. Pure taste, pure goodness. Experience nature's Gatorade. Visit Once Upon a Coconut or naturesgatorade.com.